And once again, thank you for joining us tonight. I'm Tessa Spencer. And first tonight, 23 smash and grabs at an apartment complex on Daniel Island. Our Conley Grayson spoke with police and some people whose cars were broken into. Here's what they had to say.
Charleston Police Department says nearly 24 cars were broken into at the Wharf 7 apartment complex. Police say the suspects were looking for firearms.
People leave everything in their cars, including weapons, and I think the culprits see it as a quick, easy way. It avoids background checks. It avoids having to go to a store, pay for it, or anything like that.
Jared McCarley lives here. He says officers knocked on his door Monday morning asking for surveillance video his cameras might have captured of the people targeting vehicles.
I looked through my camera footage. I was able to see the people that were coming through, smashing windows, grabbing stuff out of the people's cars, and then stopping by again and checking door handles through the cars and everything.
On this video, there was a patrol car, I believe, within 10 minutes of when this happened. So we were in the neighborhood. We were actively patrolling for this. Unfortunately, criminals are smart. They see a marked vehicle driving by. They're just going to wait, and then as soon as the opportunity presents itself, continue with their criminal activity.
Residents say this is the third time multiple cars have been broken into since July. They're concerned and want to know why property management hasn't installed video cameras.
It's a little disheartening that you're paying, exorbitant amount for rent and they're doing all these renovations to the building and yet they can't install simple security cameras.
People I spoke with say the apartment community manager told them there are no plans to install cameras. Police say they've seen an uptick in so-called window punch crimes and they'll be stepping up patrols.
Lock your car doors, don't leave any valuables, guns, weapons, wallets, purses, laptops, don't leave anything. Take everything outside the car. Don't give these criminals any opportunity to take anything.
We reached out to the Wharf 7 apartment complex managers and are waiting on a response.
Opioid addiction in the Lowcountry. That's the goal of MUSC as it gets ready to launch a multi-year clinical trial to test a new device to help with opioid withdrawals. Our Kennedy Buck is working for you tonight and found out more about how this device works. Kennedy?
Hey Tessa, so the goal of these trials is to see if this new device will minimize acute and chronic pain from opioid withdrawal. The hope is that if successful, the use of opioids will begin to decrease in the future.
Even a newborn can be born dependent to opioids. So it doesn't only impact adults or individuals with chronic pain or substance use disorders. It even impacts our most vulnerable population.
The opioid crisis is something hospitals and doctors have been trying to combat for decades. But MUSC and the University of Texas Medical Branch are hoping a new device may be able to end the problem.
As we place this sticker-like electrode on your ear, and after we stick it on your ear, patients can actually walk around the rest of the day with it stuck on their skin without it disrupting their life. And gentle electricity stimulates specific nerves in the ear to perhaps help them improve with their pain symptoms and reduce their opioid dependence.
For the next 5 years, medical teams will lead clinical trials to test the device on patients.
So what we're doing is testing the device not only in patients in Galveston, but also in healthy individuals here in Charleston, where we'll be looking at answering exactly that question. So how does it work? And how does stimulating a nerve in the ear activate the brain? And how does that help these symptoms?
The trials will also study the brain.
We're also doing a lot of interesting neuroimaging. And so we're scanning the brains of chronic pain patients and of healthy individuals, not only to compare them to each other, but also to look at their response to the stimulation.
The goal is to not only help current patients, but to protect future ones.
Opioids are a detriment to the society, and anything we can do to replace them as treatment options and reduce our burden will not only impact those individuals' lives, but future lives as well, and unborn lives.
The clinical trials are still looking for 136 patients to test this device. You have to be healthy, over 18, and have no metal in your body, and compensation will be provided.
The new superintendent of schools for South Carolina knows there are a number of crises facing our classrooms, and she says she's ready to tackle them.
One of the issues we wanted to discuss with her during a visit to the Lowcountry is drug abuse. Tara Jabor working for you tonight. She found out none of the schools in the Tri-County track overdoses on school property. Tara?
Tessa, Katie, now we found this information behind me from the CDC that says for kids ages 14 to 18, overdose deaths increased by 94% from 2019 to 2020. For that same age group, overdose deaths increased by 20% from 2020 to 2021.
State Superintendent Ellen Weaver made her first official school visit in the state here in the Lowcountry. She toured R.B. Stall High School and met with students, staff, and district officials.
When I think about the students that I have been called and elected to serve, I think about students all over this state who are sitting in classrooms who need the opportunity of a great education.
We got a chance to ask Weaver about some issues that students face.
How do you plan to address students' concerns who do have mental health issues while they're at school and in the classroom?
I fully support Governor McMaster's push in the budget to make sure that we are making mental health access much more prevalent in our schools, ensuring that we are paying for those services that students need.
Weaver says she believes parents, community members, and school staff need to be involved to find a solution.
I think we also have to be very intentional in freeing up the time of our counselors within our schools to ensure that they aren't bogged down with red tape, but rather are able to be with the students that we know that they are called to serve.
After calling our Tri-County districts, we found out that none track overdoses that happen on school grounds. We asked Weaver about the opioid epidemic in our schools.
We can't ask our schools to solve all of society's problems. I really look forward to listening and learning from our mental health professionals who are on the front line to better understand what is currently happening in our schools.
And we also asked Superintendent Weaver if she thought Narcan in schools was a good idea. She told us she has to consult medical and mental health experts.